So, we had questions about grief. We had questions about other sorts of things as well. So, shoot them at me. Right up here. Could you stand up?
I agree with everything that you're saying, and that that we do have to teach our folks to look to each other for support and all that kind of stuff, and that we're not there to provide every emotional need. But to have like a pat rule of the way in which to hug or the way in which to touch, if somebody is experiencing, I had a consumer who experienced the death of a parent, and it was a very difficult time for this person, and I have been a constant in this person's life for a few years now, and they needed like that hug, and I didn't stop it just like a waste. I mean, I gave the person a hug. When you're experiencing grief, it's a different set of circumstances than going over to say, wow, nice job with the dishes.
Yes, it is. It is.
Any kind of.
And I'm glad you asked me a question. And please, as I'm doing the presentation, don't be judging yourself, okay, about what you did before versus how you may do it in the future, okay? Because when I first heard people talking about this, I had, oh my God, oh my God. I do believe in a pat rule, okay? I do believe that we are never bear hugging a person with a disability. However, as we just did in terms of talking with somebody who works with people with disabilities who are a little bit more handicapped, well, then we have to get creative, okay? Imagine for a second here that Nicole and I are in a group home. So let's imagine that her mother died, or that her boyfriend broke up, or something traumatic has happened, and she's in serious grief, okay? So she's coming to me with a great big hug. Now the question is, do I let this happen? The answer is no. I am not going to allow that to occur. What I'm going to do is take control of the situation immediately. Remember, you're the professional. Okay? Now she's in an emotional state, and the last thing that you need to do is let her emotional state cloud your thinking. Okay? So what we're going to do is I'm going to put my arm here and say, tell her that's horror. I want her reassured. Can we go sit down in the front room? Okay. So we're going to go to the front room and sit by the couch. Okay? Now, the moment here I sit down on the couch with her, and I can put my arm around her like this, it's still a side hug. I'm going to be willing to bet, Nicole, that I have stood up with my arm around you a fair bit. But the moment we sit down and I do this, doesn't that feel more intimate? Yeah, there's an increase in intimacy. Now, if she tries to get up on my body, if she's crawling or whatever because she's really upset, I'm not going to allow that to occur. But I'm going to be able to have my arm around her. If she needs to, she can lean her shoulder in, and I can say, oh, I'm sorry. Now, let me say that you're my supervisor. You walk in and you see me with my arm around her, talking to her gently. What are you seeing?
Well, I'm going to have to question what I'm seeing.
You're going to have to question what you're seeing, but what does it look like?
Pause the tape and respond to the following. If you see someone with their arm around a client and gently speaking, what are you seeing?
Looks like a staff person and a participant having an intimate moment.
Does it look like an intimate moment? I think it looks like comforting, okay? You're right, you do have to question what it is. I think that looks like comforting. You walk into that front room and you see me standing up, her standing up, my body up against her body as she's pulled into me and she's crying on my chest. I mean, which of these looks more appropriate? Which of these looks like what it is, okay? Yeah, the couch looks way more appropriate, okay? And you need to be aware, us being allowed to do this as a profession is way more than any other profession is allowed in terms of the access to their persons, okay? So we have to be very careful with this. Also, take a look at this from another perspective. Imagine for a second here that Nicole is a woman who doesn't have a disability, who had the same loss, okay? That she lost somebody in life, there's this great big hole in her heart, okay? She comes to me as her therapist. Okay, and as she comes into me as her therapist, and I see she's got this great big hole, and she's lost, and she's vulnerable, and I get real close to her, and I hold her, and I maybe stroke her leg, or do any of that kind of stuff, and you know what? It feels good. For her, it feels good. She's lost, she's vulnerable, she's alone, she's feeling just this incredible hole in her life. As time goes by, and she becomes stronger, and she begins to start to deal with it just because of time, will she think back to those therapy sessions in which one of these two ways? Wow, when I had a major need, that man met my needs, he held me, he touched me when I needed to be touched? Or will she think, when I was at my most vulnerable, he took advantage of me? What is she going to think? What's your guess? Yeah, that he took advantage of me. So what I'm going to say, just like I said with you, when the person's disability is greater, we've got to have even more boundaries and even more safeguards. When she is in an emotional need, we need more boundaries, not less boundaries, okay? So what we want to do, and what I'm encouraging here, is creative thought. Okay, that when we're in these circumstances, if we're not going to be allowed to hug, and if you're hearing me, the only thing I'm saying absolutely no to is the hug. Okay, I'm saying that there are other things that we need to be doing as well along that way. Yes, please.
I was just thinking that, in the residence, some of my guys learned at home that that kind of bear hug is
Yes.
like in family.
Yes.
And our guys tend to overgeneralize. And they
Yes.
they may do it at home, and then some of the residents, we want to create a home-like atmosphere.
Yes.
In their new home.
Yes.
How do we sort of, teach them the difference between, the difference between going home to our families, and we do that here, and then,
Yes.
We're staff, we do lots of home-like things, but we're not really, we're not really your family.
Well, the thing is, I don't think it's unhealthy to have that clear from the very beginning. I think it's unhealthy to have it unclear from the very beginning. That somebody comes in and sort of like, oh, I left my parental home where I have a family, which is stable. I come in here where I'm going to have a different mom and dad every 6 months. I don't think that makes sense. I think it is much better to be very clear off at the very beginning. Please understand something. People like boundaries. People like to know what the relationship is. People with disabilities, when they come to me for counseling, they are so damn confused as to who the staff are to them, okay? So you know why people with disabilities get hurt by staff so much? Because has this ever happened to you? And be honest, because this is something I deal with in the clinic all the time. So here's a person with a disability, and you're sitting yakking with them. And right now you've got the friend hat on. Okay? And you're yakking away, and the subject of conversation turns to an uh-oh. They're starting to tell you something that's a little inappropriate or something that's going to have to be dealt with. Isn't it true that in your head, the friend hat is coming off, okay? The staff hat is coming on, okay? And you tell them. Most people don't tell them. Okay, all of a sudden you switch your role a bit, you start to ask them questions, you're doing a little bit of investigation, and then you end up reporting it. And then you have clients who are outraged. They don't understand. Well, you're my friend. You told my friend. Why did you write that down in my report? Now everybody knows. Has anybody had similar things like those happen? This is horrible and completely unfair to people with disabilities. We lie all the time and call it healthy. Okay? And I don't think we should be lying. Now, I do not believe that we should be saying to a person with a disability, no, I'm not your friend, I'm your staff, okay? I think that can be really kind of cruel. But what we need to do is really look at, we have a friendly relationship. Yes, we care about the people we serve, but no, I'm not your friend, I'm not your mom and dad, okay? You have to make your friends. I'm here to help you do that, okay? I think role clarification isn't hard for them to take. I think it's hard for us to do, because we feel like we're being cruel, okay? We're willing to leave their heart broken for 2 years after we've left them because we haven't told them the truth, but we don't have the courage to state up front what that relationship is and clarify those moments when they come along. How many of you have ever had your clients out of the blue say, I love you? Okay? Do you know what, when that happens with me, let me ask you a question. Is it possible to have a loving moment with people you just like? Is that possible? Happens all the time, okay? So one of the things that I will do is, let's say that, we had just done something fun together. We went off to, did some shopping, and we'd been to the mall, and we saw something very funny, and we laughed and so forth, and we're driving home, and Nicole says, I love you, Dave. I don't want to get into challenging that or diminishing what she said. Well, I say, yeah, I love going to the mall with my friends, too. Okay, so that I'm making a little bit clarify, or love going to the mall with people I like to. I wouldn't say friends. So that I'm making it very clear that that's a moment that happened. Why lie? I mean, that's okay for her to have that feeling. I have loving moments with people I just like all the time, okay? And I shouldn't feel threatened by it, and I shouldn't want to diminish it. But I should clarify it so that it's clear what's going on here. And I'm not accepting that as a statement of love.
Pause the tape and respond to the following. Thinking about the people you serve, what are some respectful ways in which you can clarify your role? 3 things which are important to remember. Do not challenge the individual's behavior, clarify the context, and acknowledge the moment.
Now, yes.
Now, I have some I have some clients that substitute behaviors to get this touching kind of reaction
Yes.
kind of thing. For example, I have somebody who she will, like punch out staff and hit staff and get herself into a skip rack position and then come back. And when he hugged me, it was the most wonderful thing because she's always got this thing of rejection.
Yes.
Like she feels rejected, nobody wants to hug her,
Yes.
nobody wants to be with her,
Yes.
but behaviors lead to that.
Yes.
So what do we do?
Well, what we need to do, I don't want to talk clinically because I don't know that person and I never give clinical advice from a podium. But I have worked in those circumstances. And one of the things that I'm suggesting here is if we're going through a shift, I think first thing that needs to happen is that this agency or any agency watching the tape that decides that they want to make a shift in how they're going to provide service, that they're going to be a little bit more clear on what the staff roles are, that they're going to establish some rules for what's acceptable for staff to do and not do in terms of the showing of affection and so forth. Then we have to develop a process to get that into place. And it should be a slow process. Like I said, slowly weaning it out for that. If we have somebody right now who's engaging in pretty heavy-duty acting out behavior to get hugged, I'm willing to bet one of the things that we know from behavioral studies is the more of a behavior problem somebody is, the less touch they actually get. So what we would want to look at is there appropriate touch being given at all sorts of other times for this person, or is the only time they get hugged when they act out and then we have to pin them to the floor? You got a problem, okay? So then we want to make sure that there's all sorts of different kinds of touch and affection and closeness and so forth. Okay, however, I want to sort of expand that to go to one other major problem we have because we do have to talk about other intimate care issues. Yes?
How do you do that, though, in an agency where, say, sexuality is really frowned upon? I mean, I just did a training at an agency where if people were found being sexual in any way,
Yes.
they were punished. So how do you then, try to facilitate getting hugged or touched from some way that's appropriate if the way that would be appropriate, which would be in other kinds of relationships and staff relationships, are discouraged? So what do you do with that? Staff are the only people that might possibly ever touch you.
Well, the way that I look at it is remember, I haven't said no to all touch. I've said no to the bear hug. So there's still all sorts of other the touch that can be done. And the thing is, we shouldn't be allowing staff to engage in behavior which leads to abuse, okay, for any justification. Okay, we shouldn't blur those kind of boundaries. I mean, 80% of our women are being victimized, 60% of our men, and it's being done by us. And I think by putting in some rules that allow people with disabilities to come and say, before the rape, so-and-so gives me hugs and that kind of stuff. I love that, okay? However, let me tell you, in some of the agencies that I've done this kind of training in, what ends up happening is these people who are in this session go back to their agency angry. Okay, because they now realize that it's all been a lie. It's all been a lie, okay? We've been in there meeting their emotional needs. We've been doing all that kind of stuff. You're now pulling us out there. We're going to have a client population that is desperately alone and isolated. And by the way, Stephen Reese and all those people who do research in this field say the lives of people with disabilities now, these are not institutionalized people, living in the community right now are typified by loneliness and depression, okay? And I believe that to be true, okay? Because they're a lonely, isolated population. They're lonely, surrounded by us, and that to me is awesome, okay? So what we want to do is that, firstly, as consultants to agencies, I think we have to be really working towards appropriate sex policies. They are out there, okay, and develop them over the course of time. But we have found when the frontline staff starts screaming, there is a wonderful, wonderful, wonderful soil to begin to work in because they get it, okay? And one of the things that I found in the area of sexuality, which is different than any other agency or any other issue I've ever worked with, change almost always comes from client and frontline up. Beginning to demand standard, beginning to demand those sorts of things. So if even 3 or 4 of these staff went back and say, excuse me, but holy shit, if we do this in 2 years, Nicole is going to be all by herself with nobody touching, with having no relationships. We got to do something about this. And then talking to their supervisor, well, what's their policy? Where's their policy? Shouldn't we have a policy? Can't we get something in place? Then change begins to occur. But it was only when people were facing up to what we did, okay? And what I think is, by allowing us to continue to lie, to continue to misrepresent, we're going to continue to hurt people with disabilities in a variety of different ways. And I see the frontline staff as probably the most potent change force within an agency once they get the concept. And I'll tell you, once they get it. The other thing, too, when we've begun doing this, we start usually with frontline staff hating what I've said, and by the end, loving it, because they love the clear directions, they feel safer while they're at work and so forth. One of the things that we don't want to leave people with disabilities believing is that touch equals affection, okay? Because if we do that, we have all sorts of problems here. Imagine here that Nicole is a woman with developmental disability, and we've gone through that procedure. She used to be a hugger, and eventually, you know, we got her 1 time in 3, 2 times in 3. So now that this is absolutely acceptable to her, this is not the end of the program, because this would still leave her believing that touch equals affection. You can sit down for a second. I'm going to tell a story. Here's a young woman with developmental disability who's being travel trained, okay? So she's learning to go on the Toronto Transit system, to go from one place to another and so forth. And we have a travel trainer who gets on the bus, who does all the things they're supposed to do. She can't read, so she's looking at various things in the community so that she can go from one place to another. Well, the way the transit system works in Toronto is that the bus driver who drives always drives the same route. They don't go around from route to route to route. So they come to know their passengers very well. Well, on the day that this woman is making the very first drive all by herself on the bus, she's thrilled. So she's standing like on a Monday morning, big grin on her face. She gets on the bus, and the bus driver says something real nice to her, like, wow, it's sure nice to see somebody getting on my bus smiling, okay? So she nods or whatever, goes and sits where she's always sat on the bus and makes the ride. Over the next several weeks, what's supposed to happen in human services in the community actually does happen, okay? All of a sudden, she's now sitting up at the front of the bus, and she's engaging him in social conversation. This is wonderful. He's not paid to like her. He's not paid to be in relationship to her. They're just two people on a bus who get along pretty well. Well, tragedy happens this day when he says to her he's going to go on a vacation for a couple of weeks, but when he comes back, he'll bring her a postcard. So fine. She goes home, and in her home, she has a calendar, and on the calendar, she marks a date for when he's going to be back. Her bus driver's coming back. Well, she waits every single day, ticking off in the calendar for her bus driver to get back. Now, when he gets back, he drives up to her stop. She's waiting there for him. She looks into the bus. She sees his brown TTC uniform, out of which is poking a postcard. She knows that she has been remembered. And how do you think she feels? She's flooded with affection. What do you think she does next? If you said hug, you're incorrect. A hug is a mutually agreed upon touch between two people. She assaults him. She grabs him like this, okay? And he freaks, saying, don't you ever touch me like that again. Sit down there right now. He's really angry at that touch. She's shocked, okay? She sits there. He doesn't speak to her. When he drops her off, he tells her again, don't you ever do anything like that to me again. He doesn't give her the postcard. She goes into work. She's traumatized. Everybody knows that she's upset. Did something happen at home? No. Did something happen on the bus? Yes. What happened on the bus? Oh, it hurt. Who hurt you? Did the bus driver hurt you? Automatically, that kind of questioning begins to occur. She says no, but she says nothing more. The next morning, she goes to the bus. She's standing. She's scared. But when the bus pulls up, he's not driving anymore. She's devastated. She gets on the bus, she's crying, she gets to work, she goes in, she's crying, she starts to talk about the bus driver, and it's important that you know every questioner tried to get her to say that he had abused her, okay? But she didn't. She just said, he got mad, I gave him a hug, he got mad. Now fine. I'm called in on now, and eventually I managed to find the bus driver. When I meet the bus driver, I have to tell you, I think this is a man who's very much overreacted, okay? However, as I began talking to him, this is the first thing that came out of his mouth. You know what everybody on that bus is going to think, don't you? Now let me ask you, here are all these people on the bus seeing this woman with a developmental disability giving this bus driver a great big warm hug. Tell me what's going to cross people's minds. Be honest. Tell me. What do you think? Yeah?
That he might be molested.
Yeah, that he's taking advantage of this poor handicapped woman. He said, no way in hell I'm going to buy that kind of trouble, okay? And as we began to talk, I learned something important about me, and that is inherent sexism creeps in all the time in clinical judgment. Because you know what? If he had been a female bus driver, and she had been a female bus driver, and the woman had been a male client with a disability who got on the bus and grabbed him, I would have seen that as a frightening incident, and that the person having a right to strongly reassert what the boundaries were. But because a man did it to a poor woman with a disability, he is being an out-of-control man who's victimizing women. I mean, that's what happened in my head, and I'm wondering if that sort of happened in your head too. He has a right to feel victimized as well. Here's the tragedy. The tragedy, she wanted to pass him a nice feeling. However, she has learned touch equals affection. So you know what, Nicole? We don't stop here. We want to move from here to teach her that there's a lot of other ways to show affection, okay? Now, let's imagine firstly that I'm the bus driver. Imagine that this is that young woman. Imagine she got on the bus and she said to me, okay, wow, you've been gone for 2 weeks, I really missed you. Okay.
You've been gone for 2 weeks and I really missed you.
Now, if she had said that to him, how do you think that would have made him feel inside? Oh, beyond good. I mean, these people get treated like crap every single day by 4,000 people who get on their bus, and here somebody gets on the bus and says something nice to them. I think exhilarated. And you know what he would be doing right now? He'd be going around saying, wow, I got this retarded woman who gets on my bus, and she's the nicest person that gets on my bus. I don't understand why we lock those people away. But you know what he's saying now? Retarded people are dangerous. Stay your distance. They'll get you in trouble. It's not fair. But he's the victim. He has a right to say whatever he wants about what occurred to him. And the tragedy is, she wanted to hand him a nice feeling and had no skill to do that, with the exception of touch. So we need to teach something here.
Pause the tape and complete the following exercise. List other ways in which people show affection.
Let me ask you, what percentage of affection-giving skills are actually touch-based? What percentage of affection-giving skills are actually touch-based? Take a guess. It's only about 8%, okay? Think about it for a second. Can you guys do that magical stuff here, even in this building? Can you walk by somebody's office, glance in, see them on the phone, have them look up at you, and without them even interrupting their phone call or you breaking stride, can you show them affection? Sure. Oh, easy, okay. How many of you ever done that magic thing? You're driving in your car, this direction, at about 60 kilometers an hour. Oh, sorry, for the States. Miles, 60 miles an hour, okay? And another person is coming in that car 60 miles an hour, and you're about to pass one another. You recognize the car, you recognize them, and in a nanosecond, can you show affection to that person? It's amazing. What are you doing? Leaping through your car window, grabbing them, and leaping? Of course not. There's 1,000 ways. We do it through tone of voice. We do it through thumbs up. We do it through little signals. I mean, at home, we got a couple of words we use, which we think is hysterical, and nobody else would ever get. And that's neat, okay? Because it's a way of showing affection and bonding and so forth. And we're going to leave her so handicapped as to believe that touch equals affection. More than that. Turn around, face me. Imagine that you and I are just friends, okay? And that we're out for dinner, okay? And there's a table between us. How many of you ever had this happen in your friendship? That you're in a restaurant, crowded full of other people. There's a table in between you. There's an actual physical barrier. And you're leaning in, talking to one another. And then all of a sudden, that magic thing happens where the rest of the world disappears. And the warmth throws back and forth between the two of you. And has that happened to anybody else? Doesn't that feel nice? And isn't that more important to the maintenance of that relationship than the kiss you give to one another at social convention at New Year's? Isn't that more important? Then why aren't we telling the truth? Let's imagine I'm a staff who works with you. I drop by your apartment because, well, it's my day off, but I'm going to the mall, and you want to come and give me a hug, even a side hug. You know what I'm going to say? Nicole, sometimes you don't have to hug me. Sometimes it's really important that you tell me that it's important. Can you just say, thanks, Dave, for coming by? I know you didn't have to. Can you say that?
Thanks, Dave, for coming by. I know you didn't have to.
Do you know, when you say that to me, it makes me feel really good inside. You don't have to touch me all the time, but sometimes I have to hear it, and that's the best way of touching me because it feels good inside here. Isn't that the truth? I mean, how many of you, when had a person with a disability just sort of thank you out of the blue? And doesn't that feel really good? Doesn't it feel better than any hug you ever got from them? Why aren't we telling the truth? I want Nicole to have the same kind of repertoire for affection-showing behavior as anybody else does, and we have to systematically teach it. So we're going to go from this kind of hug to some actual physical distance. We're going to teach her. We can sit beside each other in the car, going for a drive, having a nice conversation that's real private, say, doesn't it feel really nice to be private together here? Doesn't it feel really, why aren't we bringing those issues? We're not even physically touching, and yet we can have those kind of moments. Because then what happens here is a man with a developmental disability who touch equals affections. He goes into a store, there's a brand new store clerk on there. The last one used to be mean to him and call him a retard, but now we got a new one on, okay? And the new one smiles at him and says, nice to see you. And he's leaping right across the counter to hug this person because touch equals affection. She showed me affection, I want to let her know. And now he's, of course, in jail. So when we're looking at these things, we want to make sure of what we're teaching and go the full distance in terms of that. We are very strict on that if you're brand new staff, you don't provide intimate care, okay? Do you think that that's possible? Do you think that's feasible? And by the way, students who come in for student placements from colleges never provide intimate care within an agency.
Pause the tape and respond to the following. What are your current guidelines about who provides and who does not provide intimate care? Do new staff and students provide this care?
Yes?
It's not always feasible because when you're hiring a staff person, the reason you're hiring them is because you have staff issues, you have coverage issues. So that person might be underflowing coverage before you have time really to develop a relationship.
Ah, good. Okay, so we might hire somebody. You're right, we're hiring people because there's staff turnover and we have certain things that need to be done in the house. Well, this is how we've done it, okay? Our goal is no brand new staff providing intimate care. That's the goal, okay? Now let's look at the reality, okay? Let's say most of the places that I work anywhere, where there are people who need intimate care, there's usually one or two staff on, okay? Because they have to, you know, the way they have to structure the staffing so that needs being met in a variety of different places. So if I'm a brand new staff on, okay, and you're known to the person, then during the period of time when I'm there, you're going to do all of the intimate care stuff and I'm going to do the public stuff. I'm going to help with the cleaning and the cooking and the other kinds of the stuff that doesn't require me to be in the place. And yes, that means that the people who've been there longer are going to provide that service, which often is a little bit more labor intensive and often not as pleasant, okay? But when our staff understand that what they're doing is ensuring that people with disabilities aren't going to get hurt, they don't have a problem with this, okay? So that's number one. Now let's take a look at, that's the best possible scenario because there was somebody right there who was already there that could provide the service. Let's say that you and I are on, and we're both brand new. That happens all the time, okay? We have two brand new staff on, and it's that person's bath night. Well, let's take a look at the calendar, okay? And let's see whether or not tomorrow some other staff are going to be on who know her better. What about waiting till tomorrow? You know what? We criticized institutions for having an institutionalized approach to living life, to having all of these menus and all of these rigid schedules and all these, and then we just adopted it in the community. It didn't make sense to me. So if you and I take a look at the schedule and discover that you're coming on tomorrow and you're known, isn't it more important that she be bathed by somebody that's known to her and that she's comfortable with than one of us strangers? Okay, that is, of course, if the person doesn't have a problem with the shifting of schedules, because some people do. All right, let's say we look at the schedule and, uh-oh, it's all new people here. That always should be a big warning to you. If you've worked in an agency, you walk in and you take a look around, and the person who's there, and they're the senior staff, has been there 6 weeks, okay? Be very wary. Start looking for another job. Although in one agency, somebody actually became the executive director because of 6 weeks seniority. I couldn't believe it. So easy way to work up the ranks. So okay, so we take a look at, and the next person that's coming on is somebody who's also unknown to them. Now this will get scary. Then we say, who's the supervisor of the group home? Because one of the things we know, the turnover rate decreases as you go up the hierarchy, okay? So has the supervisor of the group home been with that group home for a long period of time? And as that supervisor has been there for a long period of time and got a bunch of new staff on, then that supervisor should be coming in and doing the intimate care. And you know what I believe? I know that I get in trouble for this. I don't think a single person should make a living off a person with a disability that doesn't know them. Okay? I really believe that, at all levels within a field, okay? So I think that that's important, that people who are in supervisory roles are keeping in touch with their clients anyway, okay? So what say then we look at the supervisor and it's a brand new supervisor too? Then let's take a look at staff records to who went where, okay? Did somebody transfer from this group home to that group home? Did this supervisor go there and not supervisor? Is there someone around in the system that's close that we can relatively easy bring in for a week or two to do some coverage here? No. Okay, what then? Okay, then we talk to the parents. We say, for the next couple of weeks, we've got brand new staff on here, there's intimate care being done here. Would you like to help out with the intimate care with your child? And before you go, yeah, right. You know, I did a book with parents. And it was a book on sexuality and developmental disabilities, and the parents wrote in questions for us. We had over 1,000 questions that parents wrote in. This was the single most asked question. How can I help so that my child doesn't get hurt? You know, parents are already concerned about this. So we call in and say, you know, for 2 weeks, would you mind doing the bathing routine with your son or daughter until they get a little bit used to the new people in? I think they'll be shocked that you cared enough to ask them, okay? And many will say absolutely sure. And then if they say no, how many options have I given you now? Probably 5 or 6 options. And then they say no. Then we're left with you and me. And it doesn't matter genders here, okay? It doesn't matter the gender of that person. Then it's going to have to be one of us. All right? So what we're going to say is this. What's your name? Kimberly. Jane over here. I'm not sure who she's the most comfortable with. Does she seem comfortable with you? Does she seem comfortable with me? Can we acknowledge something in this field that makes everybody really uncomfortable? I don't like all people with disabilities. And anybody who does is a bigot. Okay, because that means they can't see individual differences, okay? And you know what? All people with disabilities don't like me. That's because they have a handicap. No, all people with disabilities don't like me, and I don't like all people with disabilities. I have greater rapport with some than with others, and that's true for you too. And I don't think we talk about that enough and acknowledge it. And what if Kimberly says, you know, with Jane, I think she seems pretty comfortable with me. I know she doesn't talk, but whenever I come over, she smiles and she looks at me and so forth. Isn't that kind of like making a selection of the new people who she sees more comfortable with, and let's do it then. However, that's the last choice. We don't go there first. Now, since we put this in place, imagine you're an abuser. Okay, oh boy, it's bath night, oh boy, it's bath night, oh boy, it's bath night, okay. Imagine you're an abuser, okay, and then all of a sudden you're hit with, nope, you're not providing intimate care because you're not through probation yet, we don't know you well enough yet, and the client doesn't have a relationship with you. Huh? An agency with values? What am I doing here? That's number one. And then we start going through all of these other questionings here. Does this seem like a safe place to work? If you're so concerned that this person feels comfortable and safe, then this is not a safe place for me to be working in this agency.
Like when you work in a residence and you have to lift someone, you have to get in very, very close to them to get them off. You actually have to put your hands around
Yes.
them off bed. I mean, talking about touching, is that an inappropriate way of touching?
Lifting is more intimate a touch than toileting. Okay, most people think it's the other way around. Lifting is more intimate and way more intimate. You're being borne up into the air. How many of you have ever gone off to one of those training things that they like to do where they get you in a great big room and then they stand a whole pile of people around you and you're all supposed to fall back to show that you can demonstrate trust and all that? You ever had to do that kind of stuff? Is it hard to fall back?
Yes.
Why? Trust to be borne up by another. I mean, that's something very hard to get over. By the way, I refuse to do that exercise unless I am surrounded by sumo wrestlers, okay? I don't do that exercise because, no, I don't trust that you can do it. Let's take a look at Nicole here. Imagine that she is a woman in a wheelchair who has no traditional speech, okay? Now, I'm going to do this in two ways. One, let's imagine she has no startle effect, okay? Because a lot of people with disabilities have a startle response to when we come. Let's imagine, firstly, she has no startle response. So I'm going to come up behind her, and I'm going to address her. Nicole, what did she do?
She looked up at me.
And the moment she looked up at me, she's doing what? She's participating. Okay, to the maximum that she can. Now, if somebody has startle effect, I'm not going to do that, because that's not particularly fun. I'm going to come down from in the front and say her name, okay, because I want to have that. How many of you work with people with disabilities who don't say a single word? But do you notice that they recognize you? How do you notice? Isn't it in there? It's in their eyes. Okay, you're absolutely right. So I'm going to say her name. Now, we're going to engage in parallel talk. Okay? Okay, Nicole, I'm going to lift you now. What I'm going to do is I'm going to put my arm here, okay, and now I'm going to put my arm here. Now, everything that I'm going to do from henceforth, I'm going to say out loud exactly what it is that I'm doing. Because what I want her to hear is the words. And you know what? I don't care if she doesn't understand a single word. That's irrelevant to me. What I want her to understand is that something special is going on here. So as I'm coming over, I'm going to do it from this side, as I'm coming over to lift her, and I'm telling her that arm is going here, arm going here, do you know what? You don't even have to train tone of voice, because all of a sudden people's voice get very gentle. Okay, Nicole, we're going to do this, we're going to do this, okay. Rather than the sack of potatoes lift that she's actually used to, somebody just picking her up and moving her. Through the whole entire time, there is dialogue coming from me to her. Now, let's imagine we have a brand new staff on who has not yet been trained to do parallel talk while lifting, okay? Now, they come and they, without even speaking her name, come from behind and do something like this. What do you think she's going to do? She's going to rear back. Tell me what that means. What does it mean? It means, no, don't touch me. It says, treat me with respect. Because you know what? If she's had somebody lifting her appropriately, talking to her, doing the parallel talk, for even 3 weeks, you will find somebody addicted to respectful care. Because people get addicted to respectful care real fast. And then when somebody does it wrong and she rears back, what occurs in my mind if I happen to be a victimizer? Tell me. She's resisting, and she's resisting how I lift her, for God's sakes, okay? This is not a good person to victimize here. So part of what we want to do is make sure that we're doing that in that way. I want to talk about one other controversial thing before we move on. I want to credit my source here. Jean Edwards talks about why the abuse is so enormous in our field, okay? And she said one of the reasons it's enormous in our field is that unlike other fields, if you're going to be in teaching or if you're going to be, you know, working with kids in a variety of different environments, you know, you're already aware that kids can be pretty attractive and all that kind of stuff. So you're kind of on guard, okay? And you're on guard about your behavior, and you are really on guard about your boundaries. However, most of us who work in the field of developmental disabilities come in, and people with developmental disabilities often look a little bit different, and they aren't attractive in the standard kind of way, and therefore we kind of think, never happened to me. I would never have to worry about those boundaries because, you know, it's clearly not a sexual thing here because these people aren't sexually appealing, okay? And we may not think these things out in our head, but that's kind of what's going on in the quick analysis of the people we look at. Now, let me ask you a question. Have you ever had a friend, forget disabilities for a second, have you ever had a friend that when you first met, you were kind of, they weren't very attractive people. And then you get to know them a bit. And they got a great personality, a great sense of humor, a real gentleness about them, a bit of wacky at the same time. And all of a sudden their personality starts to shine through. Do you ever notice something? What happens? They become more attractive, sometimes downright hot, okay? Because all of a sudden, like, wow, you know, because the personality overrides. What Jean Edwards says is people with developmental disabilities often have wonderful personalities, and you get to know them, and all of a sudden their personalities are shining out through them, and all of a sudden you aren't prepared for the fact that you're in a bathroom, you're doing bathing, and you're aroused. Okay, and you're just not prepared for it. And more than that, you have no one to talk to about it because you're afraid that if you tell anybody in this field, you're going to be seen as an absolute psychotic, out-of-control molester, and you're left to deal with those things on your own, okay? You need to be aware it happens. Happens all the time. You know what? When I'm in close confined quarters with somebody, I think that that's an uncomfortable situation. And I think we need to be either looking at somebody else doing that or some other kind of assistance doing that. And I think we should be doing that a little bit more often, being aware that this happens all the time. But the field is, we're not given permission to talk about that.
Pause the tape and respond to the following. Do you think this needs to be addressed in your workplace? If so, how?
Now I want to put you to work. I'm going to give you a few situations that were occurring in a real-life group home before we started to think about these whole issues of privacy and how we provided service. I'm going to sort of give you a quick schematic of the house. I am clearly not able to do much in the way of drawing. Here we have the front door to the house. Here we have the back door to the house. Like many houses, people tend to drive up the driveway and come in the back door of the house. There are 3 residents that I want you to think of who live in this house. The first is a woman who, first thing in the morning, she sits on the toilet for a long period of time. Now, I don't remember what the actual condition was that required her to have to sit there, but she's strapped onto the toilet. No, she's not tied in, but she's strapped on just for security, okay? Right now, in the morning, when the staff is quite busy, there is only 1 staff on, she'll every now and then peek in this door, which is open, to see how she's doing. The woman is seated naked on the toilet. The back door here, there are deliveries often made in the morning of a variety of different things. To delivery, people are coming in and walking by while this woman is tied to the toilet and is naked there. That is her. At another time, we have a person with a developmental disability who's learning how to shower. This happens most often in the evening, and what the staff do is, because he's on a showering program, they'll push the shower curtain over, sit down here on the tub or the toilet, and give him the task analysis to go through and any kind of verbal cues he needs necessary to help him with his shower. The third person is a person with a disability. This is a female who requires a bath. So when she goes into the bath, she goes in and she gets in the bathtub, and the staff require doing an awful lot of hand-over-hand washing with her because of the level of her disability. What I want you to do is this. Set your goal such that you can build in enough boundaries for the provision of services that the gender of the service recipient and the gender of the service provider really shouldn't matter, because there are so many boundaries in place.
Please complete the following exercise as explained in the video. This enables you to debrief the exercise with David and the audience.
So let's start with the woman who's on the toilet, okay? Let's build in some boundaries here. What are some of the boundaries we can build in?
Why is she naked?
Really good question. And let me tell you how she ended up being naked. She had a long house coat, and when she would sit in the toilet, it would bunch up behind her back and become very uncomfortable. So they ended up just taking it off to reduce her discomfort. However, this was the first thing that hit them when they started thinking about this. They took some old sheets from the house, and they made, just like those hospital gowns that slid up the back, that she could wear that over her. Now, let me ask you, if we made no other change than that one, would you feel happier in that house if you were her?
Yes.
See what I mean? Real simple stuff can make dramatic changes. Okay, but there are going to be more. What are some of the other things we can put in place? Okay, say it again?
Keep the door closed.
Keeping the door closed was a problem, okay? Because there did need to be some, and I don't remember why, some eyeball checking in terms of seeing how she was doing.
Knock and go in every.
Okay, knocking and going in. Here's what we had to contend with, okay? We have 1 staff on. And one of the things that we have a slogan in my office as a consultative office, staff are not bad people, they're busy people. We got 1 staff on in the morning, they got these 3. If we increase the amount of steps they have to take, they'll do it for a week and then probably not anymore, okay? So, but staying with the door, because we talked about that, and one of the things as a consultant to an agency, the first thing I say is, don't let me be stupid, okay? And don't let me give you advice that you won't do anyway, okay? And when we started to talk about the closing the door and the knocking and all the respect and all that, they were finally saying, it's a great idea, but we got so-and-so that has to get dressed, so-and-so's got to get fed, I've got to get this all ready and stuff. And it's not that they're bad, okay? They're reasonably saying to you, I have this much to do in this much time. Okay, so what do we do? So one of the staff in the house, they did something amazing. I didn't even know you could do this because I'm not a carpenter. They took the door of the bathroom and they made a tall Dutch door. Do you know what a Dutch door is? That operates top and bottom, so that the door was closed all but a sliver. It was like just a thing, so that they could stand and take a look, but the door was now closed, okay? If you were her, with that little change, would you feel safer and better, okay? And it's sort of taking into consideration, so again, what we tried to do in all of this is be respectful for people with disabilities, but also respectful for the demands that we're placing on staff, okay? They ended up being able to close the door entirely because they came up with some other stuff later on. So let's hear some other ideas. You had...
I was just thinking that probably, I don't know the case, probably she can let them know some way that she finished.
She can't call out, and she doesn't have the means to do that, but...
She cannot have a ringer or something?
No, that doesn't work for her. But you know what, you're right, because you don't know the case. But let's stay on the idea, because just because she can't call out, and just because she can't get a ringer, did you know that you can get inserts that go into toilets that when they're used, they set off a little buzzer? I did not know this, okay? It's the same thing. It's the same, and that's why, hopefully, when people give an idea, you say, that's a good idea. How would we make that idea work for this person? So now the door is closed entirely because when she's finished, there's a little sound comes from the bathroom, okay? All right, so any other ideas for her? Yes?
We were wondering if this had to take place if this had to take place at this time of day when there's only one staff member and when the deliveries were coming.
Well, yeah, it actually, because of the way the doctor had wanted her regulated, it did have to take part of that time of the day. But what about deliveries? You know, I mean, so with the door closed, it makes it less of an issue. But what they wanted to do was train the delivery people to deliver to the front door. Nothing happened there, okay? So yeah, so they made it absolutely clear. They put a little sign up in terms of deliveries to the front. Okay, and that eliminated that entirely, okay? And again, just reshaping it. Now, that's enough for change for her. If you were her with these few minor changes, how would you feel? Real more comfortable. And this conversation that you had, I limited your time on purpose. You did that in a short period of time. I'd love for you to go back to the places where you work and say, how many privacy violations go on here every day? What kinds of ways could we change that without taking a whole lot of effort? Now let's move to the person who's in the shower. Okay? The staff are sitting on the toilet and they're pushing the shower curtain back, watching him naked, giving him instructions. Let's do this a little differently. Yes, please.
We could get either a glass shower door where you could look through, or get one of those, see-through shower.
Okay, a glass shower door, see-through curtain. Both of those would be great ideas, okay? What they did in the house, though, was they took the shower curtain, dropped it 6 inches, okay, and sewed up the bottom. So the staff could stand, see the person, and give direction, okay? With any one of those 3 suggestions, if you were him, would you feel better about this? Oh, absolutely. Okay, what else? What else could you come up with? Yes?
We also talked about having a practice session that was separate from the showering time, where a person might wear a bathing suit, so their privacy wouldn't be violated, but the other person could actually, the staff person could see how they were washing. And then when they got into the shower, they can just poke their head out, be given the visual instruction. If it was an issue of, understanding length of time, you need to be working on your washing your arms. The person learning, the learner could set a timer.
Absolutely. So there's a number of things we could do there. We could have practice sessions in ways that don't embarrass the person, and you could put some cues into the bathrooms so the staff isn't necessary. You could even use visual cues that have been plasticized in terms of that being in there. Let me tell you what they did. I didn't even know this stuff existed. Do you know crayon soap? Mm-hmm. They bought crayon soap. All crayon soap is crayon soap. There's no other way of putting it. And it's colored soap that's in the form of a crayon. And what they did with this guy is that before he goes into the shower, he's in his shorts, okay? He puts a stripe of soap here, a stripe of soap here, using different colors, one in his chest, one in his stomach, one in his legs, one in his back. They send him in the shower, and he washes the soap off. And if the soap is off, he's clean. And if it's not, he goes back and does it again. That was brilliant, okay? He got it like that. Crayon soap was just, I love adaptions, okay? So you're right. Let's do some adaptions there. Let's either get something in there that can be visual cues, or let's change the shower curtain, or do practice sessions with him not being naked in front of you. All of these things would make it more comfortable. And also, do you realize all these things make the gender issues almost irrelevant? Okay, and that should be part of what's done. In hospitals, the gender issue is irrelevant. They have male nurses and they have female nurses, and they provide the same kind of service, okay? Now, Last person is probably the most difficult, the person that's in the tub, needs some hand-over-hand assistance. Let's build barriers. I want lots and lots of barriers. What are they? Yes?
You could put some distance by using some sort of a long-handled brush or a sponge dispenser.
Okay, long-handled brush or brush dispenser, great idea. What we did in this case was, you know those great big huge pink sponges you can buy? They're huge, okay? We got those for the same reason. And what she said is the reason why. It was the distance, okay? To get some distance from your hand away from any private part of the body. Okay, that's one barrier. Give me another one. You got the sponge? Yes?
Well, we're thinking gloves.
I think glove is a very important thing and underused in human services, okay? If you're providing a medical services, I think we should be using gloves, okay? So hand in glove, hand on sponge, okay? Your bare skin is now a long way from that person's body. What about the visual barrier? They're laying there naked.
Using maybe a bubble bath.
Now, this is a woman, so expensive bubble bath, because bubble bath can be linked to vaginal infections and so forth, but you can get really good bubble bath that is quite okay for that. And what they had was this huge layer of bubble, and the staff would say, must feel so private in there because nobody could see you. There's a visual barrier, and now there's those hand barriers. Any other barriers need to be in place? Well, let me tell you what we did, and I know that some of you are going to hate this. I believe that when we provide a medical services, it should be looking like we're doing so. I believe in the white coats and the blue coats, that when we're in there doing that. Because it is very difficult for a person with a disability to be out there in the front room with us 1 second and then us in our street clothes in the bathroom providing very intimate care. There should be some kind of symbol. And before you panic on this, how many of you have been reading stuff in the medical journals recently about doctors and their coats? Do you all remember when doctors decided that they were all going to be in their street clothes and they were going to develop this rapport with their patients? Do you know what? Most doctors are putting their coats back on. Tell me why. Yes?
Because patients had a different level of responding.
What they say is that we want a degree of distance between ourselves and this person. We want that symbol that says this is special. I mean, when I go into my doctor's office, we sit down and chat, and the moment that I get up to be examined and take my clothes off, she puts on a coat, and I want that. Okay, because that makes me feel a lot more comfortable in our roles. When I'm off the table and dressed, she takes the coat off. But for that period of time, there's something special is occurring, okay? And you know what? It doesn't damage the social relationship that I have with her afterwards, but during that procedure. So we want to have that kind of symbol that when we are in providing this kind of services where you're naked and we're in here with you, then this is something special. It happens in a special place by people wearing a special coat. Okay, that's the people who do that. And you know what we found? That a lot of people with disabilities who used to then have trouble with doctors don't have trouble with doctors anymore because they're used to getting a certain degree of care, and there's a symbol, and this is what it means, and so forth. So absolutely that can be in there. Building in boundaries. The end result was trying to build a service where it doesn't matter the gender of the service recipient or the service provider, because we protected the boundaries so much. We have only 3 or 4 minutes left for questions, okay? So, quickly, any last questions? You had a question, Mary.
I did. I just wanted you to address the gender issue, because I think sometimes what happens is it's important to ask people who they would prefer to bathe them.
Yes.
And ask permission. And sometimes I'm not so sure if some maybe can't verbally respond or let you know that we do pay attention to, say, a 17-year-old girl. She might not want to be bathed by a male, you know, and so sometimes there is a preference.
As far as I'm concerned, I agree with you. I think because remember when I talked with no process of getting consent and permission and so forth, I think we should be asking before we provide those services, and that people with disabilities have a right to state what some of those preferences are. But also remember, in a field where there has been a lot of abuse done by women too, she may not choose a woman. She may choose a man, okay? And then there are those kinds of issues that we need to take a look at. But I do think that that choice should be there based on the comfort level of the individual, okay? That's not always going to be available. And one of the things that we want to do with the folks that we're serving is make sure that they understand it is our goal and desire to meet your needs as you've expressed them, but sometimes circumstances don't allow us to do so. But we will do everything we can to do it in that way, because I do believe that permission asking is really important. Because one of the things that we've seen Let's say that you're somebody who never has trouble with bathing, and I say, do you want to do your bath tonight? And she says no. What should I be cueing in on? Tell me. Something's changed, okay? Yesterday she didn't have trouble with bathing, and today she's saying no. She's asserting a boundary. And my first question should be what? What happened? What happened? What caused it? And what tends to happen when a person with disability says, do you want to do your bath night tonight? No. Well, get undressed. You're doing your bath night, okay? Without even everybody stop to think, hold on a second here. They didn't used to say this. And you know what? One of the very first signs of being victimized is somebody who reasserts a boundary. Okay, so we ask permission for two reasons: to make sure that they're involved in that, and the second one is to assure ourselves that when they say no, that should trigger something in our head. Oh, okay, well, you don't have to take a bath tonight if you don't want. So something going, then we can start to look at what that is. And one more, yeah?
Oh, the other question is related to sometimes people working in those circumstances also feel uncomfortable with someone saying, I want you to bath me, because they have an attraction to that person. So I get questions about, well, you know, so-and-so wants me to bath them all the time, but I know they really like me, so I'm really uncomfortable doing that. So it's reversed, so they don't want to actually bath that person, and they don't quite know how to deal with someone they're supporting having an attraction to them as a bath person.
There's a couple of things when it comes to that. Firstly, I feel that the staff have a right to their own boundaries. I think when clients are intruded onto the boundaries of the staff and the staff feel uncomfortable, they have every right to say no. This makes me feel uncomfortable, and I think that this is a dangerous circumstance, because I think we want to make sure that the staff are feeling protected as well. We don't give staff permission to do that, and we need to, so that they're feeling that uncomfortable. Because, I mean, even when we take a look at this inappropriate touch, how many of you were kind of uncomfortable with the amount of touch that people with disabilities did with you when you first got in this field? And how many of you are more comfortable with it now, not because they're doing more appropriate touch, but because you become sort of desensitized to inappropriate touch? Is that what's going on? That's what's going on here. So I want us to get back to the discomfort, because I think that that could be our greatest teaching tool. If you're doing something and touching me that makes me uncomfortable, do you know what? I used to let people with disabilities hug me and touch me and do all those sorts of stuff, because even though I was uncomfortable, I thought if I said no to them, everybody would think, Dave's mean and he doesn't like the disabled. No, I have a right to my own personal boundaries, and people with disabilities have to learn to respect those boundaries as well. And I like it when staff say, hold on a second here, something is going on in this relationship with myself and my client, and I think he's beginning to blur, or he or she is beginning to blur the distinctions, and we need to look at that for my personal safety, because that does become a safety issue, I agree. And you had a question. Oh, Aaron.
What do you do when the policy requires two people to be present?
Well, I don't know. I don't like that as a policy. What we do if we're concerned about something going on, what we'll have is, if somebody's in the bathroom being bathed, and particularly if somebody has made a complaint of being victimized in the past, and the staff is then concerned that they're in this private room doing this kind of stuff, that we'll have a staff knock and make a random quick check by going in to grab a bar of soap or something like that and leave, and document that what they saw was being appropriate. But certainly not standing in there the whole time, because then it makes it like a public thing. So that there are others. I know for myself, when I do counseling with people with disabilities, and some of whom have had in their past recorded that they've made false allegations or abuse, or there's been those things going on, I do provide the service, but I also provide for myself a safeguard. And it's usually a random check, somebody coming in when I have no idea that they're coming in, and they document what they leave when they see. Okay, so that kind of thing is in place. It's not the best protector, but it's certainly the only one that we could come up with. Okay, it's time. Thank you all very much for being filmed. We appreciate it.